Hello, everyone. You're listening to the Socially Desi Show, the podcast that motivates you to live, create, and inspire. If this is your first time here, welcome. On our show, we discuss tips and strategies with our guest speakers on how to tackle problems related to personal growth, mental health, relationships, business and entrepreneurship, and health and fitness. So hit that subscribe button and go check out our website at sociallydesi.com for more of such content. Today, I am joined by Mr. Kunal Kishore Dhawan. He is the co-founder of Navia Life Care. Hi, Kunal. Welcome to the show.
Hi, Anurag. Thanks for having me.
It's a pleasure to be hosting you on the show today, Kunal. So you've had a long, professional journey in healthcare and in the healthcare industry. So why don't you tell our audience about your journey so far?
Yeah, sure. Anurag, basically, if you start from my education, I've always been I've been brought up in an environment of life sciences in a way. My grandmother is the one who sort of
Mm-hmm.
inspired me to get into biology as a subject. She was herself a biology teacher, and since I was spending most of my growing up time in her care, it just turned out that she
Mm-hmm.
pushed me towards uh, learning more about how the human body functions and life sciences as such. I was fascinated by animals and fascinated by the natural world in a way. So getting into healthcare and life sciences was sort of a very organic thing for me. But unlike other people who were also interested in these things, I did not want to become a doctor. I actually wanted to go into pure
Okay.
sciences, and that's why after school I did my bachelor's in biochemistry from University of Delhi.
Mm-hmm.
But while I was studying for in my bachelor's, I kind of got out of the whole pure science research environment.
Mm-hmm.
It just seemed that I was not really cut out for it. So I went more into the business side of life sciences and healthcare, which was culminated basically by my doing my masters from Carnegie Mellon in the area of biotechnology and management.
Okay.
So it was like a hybrid program between life sciences studies as well as management. Once I graduated from Carnegie Mellon in the US, I actually decided to come back to India
Okay.
and work here in a pharmaceutical company. But it's so turned out that the pharma company that I was working with had their headquarters in Germany. So they asked me to move to Germany and work there for a few
Mm-hmm.
years. Um, I spent almost about 4 years working for this company in various geographies, so India, Germany, and even in the US. And towards the end of 2015 was when I basically quit my job and decided to start Navia.
Oh, okay. And what was the inspiration behind the venture?
Well, like any person who's living in a family with elderly people,
Mm-hmm.
you kind of um, you kind of realize that health is a core focus um, for every middle class family there is. We have my grandmother, for example, is a chronic disease patient. My father has chronic hypertension. My mother also suffers from things, and even my wife, for example, has to visit doctors regularly. So it was very, very personal for me to start something in the healthcare space, which was obviously coupled by my personal experience, my professional experience as well
Right.
in the healthcare and life sciences industry. So a combination of both personal and professional issues kind of drove me forward in building something in the healthcare space.
So tell us more about Navia. What sort of products or services are you providing right now? What are the current operations for the business?
Sure. So Navia basically, or Navia Life Care, that's the full name of the company, is a digital health company that is building platforms that facilitate the flow of information and between the stakeholders, different stakeholders of the entire healthcare ecosystem, and basically in aiding in decision making,
Hmm.
in better decision making across the ecosystem. So let me give you an example. As a patient, when you go visit a doctor,
Mm-hmm.
the doctor writes a prescription, and in the prescription he or she will prescribe you certain medicines. He'll probably note down some ailments that you have, and they'll give you some idea of what diagnostic tests you need to do, any procedure or surgery if you require, for example,
Yeah.
and they'll give you some instructions of how to better treat your treatment. Now, this information is basically condensed in the form of one single paper
Mm-hmm.
that you call your prescription,
Yep.
right? Um, Now, a lot of people who have chronic diseases, which basically means people who have diseases that span a long period of time, for example, diabetes or hypertension, or people with chronic kidney disease, for example, um, these people have to go and visit doctors on a very regular basis.
True. Yeah.
And every time they go, they get this piece of paper that is containing all their instructions. As you keep going to these doctors, the pile of papers keeps on increasing,
Yeah.
right?
So true.
And the information that is contained in these papers are very important for you to take care of your treatment or you take care of your health. Now, the flow of this information is basically happening through this piece of paper.
Yeah.
Now, this paper is the same paper that you will take to your pharmacy to purchase those medicines. It's the same paper that you will take to your diagnostic lab to order a test, or you will take to the hospital if you need a surgery or a procedure or so on and so forth. So this flow of information is extremely manual. It is not seamless. It requires your intervention. It requires a doctor to be present. It requires a lot of stakeholders to be taking care of this single piece of paper.
Yeah.
Now, Navya, as an organization, is attempting to digitize this entire value chain.
Mm-hmm.
Okay, so by digitizing or making this entire value chain electronic in nature, we are aiding in the flow of information across this healthcare ecosystem. Once you have a digital information source, a lot of things downstream can be streamlined.
Mm-hmm.
For example, if a doctor writes a prescription, automatically the prescription can be sent to the pharmacy via, for example, WhatsApp.
Yeah. Hmm.
Right? It's a digital prescription; it can be sent by WhatsApp, or the instructions from the information can be synchronized with the patient's mobile phone. And every morning, the patient's mobile phone rings and tells them you have to take this medicine at this time. Now, that's an automatic thing that has happened,
Yeah.
right?
Yeah.
Similarly, your insurance is automatically can be covered by this seamless information. The pharma company that is manufacturing these drugs also gets to understand how are their drugs being used, who are using their drugs, where are they being used more. So by digitizing this single piece of information that is being condensed on this piece of paper, you are able to perform or give benefit to a lot of downstream players, and that is exactly what Navya is trying to do.
Interesting. And especially, during the whole COVID scenario that we have right now in front of us, I'm sure the importance of contactless prescription is much needed right now. And nobody wants to have these many touch points, across this whole medical institution chain that we can talk about, right from visiting the doctor till, going and getting your medicines from the store. The whole I guess the whole process chain needs to be digitized, and this is what is interesting. So my next question to you, Kunal, is what sort of changes have you seen pre-COVID and now in the current scenario,
Yes.
especially in the whole infrastructure for medical institutions?
So, the biggest change that has come across by before and after COVID is a mindset change, not only in the patients but also other parties involved, like governments, hospitals, insurance players, and
Mm-hmm.
so on. Everybody is kind of understanding need for digital healthcare and understand need for having a regulated environment under which digital health can be promoted.
Yeah.
For example, when the lockdown first happened in March, it took about 10 days for the government to actually come up with telemedicine. because they understood that there was a need for, see, there were platforms that were already giving telemedicine and video consultations and virtual consultations as part of their core offerings to patients and doctors. But it wasn't a very regulated environment. There were not any there weren't any guidelines or rules with which they operated. So there was always a chance of things going wrong. But within 10 days of the lockdown being announced, there were a specific guidelines published by the you know government to promote the use of digital and telemedicine specifically
Mm-hmm.
in the during the COVID time. And this is the kind of mindset shift that was seen across the board, even for us, for example.
Right.
The number of doctors, the number of hospitals, the number of patients who readily accepted digital healthcare was astounding. Just to give you like a quick snapshot of when I make this statement, it is based on serious fact. For example, the number of doctors who enrolled in our platform um, pre and post COVID grew by almost 20 times
Wow. Okay.
during this time. So there was a clear need that they saw, and we were able to fulfill the same.
Hmm.
The number of patient interactions that we were able to facilitate using our platform over the 6 months of lockdown, if you want to call it that, from say April to October or April to September, was almost about 35 times
Hmm.
the number of interactions that were pre-COVID. And the post-COVID is also very similar. A large proportion of doctors who enrolled onto the platform during COVID ended up staying there. We have very high retention. Doctors understood that once it's like वो चस्का लगता
Yeah.
है, और
Yeah.
कहते हैं ना उसको, there is a, you understand, you get a taste of digital, and then it sort of attracts you and keeps you there.
True.
So that is something that is being clearly seen across the board.
And I'm sure with this whole, especially last year when doctors, like in the initial days when they had no clue what to do, they were really tired and they were overworked. All the doctors and everyone in the medical staff. So I'm sure with the whole presence of these kind of digital software and platforms, there would have been some sort of a breath of a relief that at least there's something that can manage things for them. Otherwise, especially last year, I have seen in a couple of hospitals, like we faced a couple of issues when we had to get in touch with the doctors and nobody was available because they weren't taking any OPD patients. So generally it was over the call and everything was managed either on a WhatsApp call or on a WhatsApp chat. Um so how does Navia Care ensures the privacy? Because you spoke about that, so wanted to get in more detail as to how does Navia Care ensures the privacy and confidentiality of their patients' data on your platform.
So basically, there are a couple of things that you touched upon in your statement. One of them was around the fact that there is a clear need that the doctors see for digital, and that is absolutely true. Not only do the doctors see the need, but I think the government, etc., has also started seeing the need for digital. And testament to that fact is the NDHM project that was announced in August of
Hmm.
last year, of 2020, which basically seeks to provide a digital health ID to every citizen of India.
Yeah.
Now that is something that is going to revolutionize healthcare and be a huge boost to startups and companies like ours. Doctors are also getting are seeing the benefit of being a part of this kind of an exercise, because they understand that keeping digital health records and getting access to patients record at their fingertips, and not having to rely on the fact that patients bring in their own prescriptions when they come in,
Hmm.
is a huge benefit when it comes to diagnosing patients.
Yeah.
A complete medical history, a complete medical record of a patient is essential to providing a good treatment protocol. Um, so consent and consent and privacy become extremely important in this kind of a scenario.
Hmm.
Even for us, for example, privacy and consent are sort of cornerstones around which our product also has been built. There is a consent manager that is inbuilt into the product.
Okay.
When a patient books an appointment with the doctor, he or she gives explicit consent for the doctor to be able to see their records,
Okay.
and they can withdraw this consent at any time that they want.
Hmm.
Similarly, and the interaction between the doctor and the patient is never recorded. For example, we keep records that the patient has interacted with the doctor, but the interaction per se is not recorded.
Okay.
So there is a clear element of privacy that comes in during a video consultation.
Hmm.
Now, regarding records or record keeping or prescriptions, etc., that are generated through our platform, they're all stored on highly encrypted servers, both from front and back end. So we take exceptional care in ensuring that the interactions are encrypted. There is no flow of documentation that is on an encrypted method, servers. Patients and doctors can do not interact on public platform. It is only through our platform. And there is OTP verification and identity verification happening at almost every step. So we take exceptional care when it comes to protecting patients' interest.
Okay. Okay, interesting. And you spoke about the problem for chronic disease patients where they have to regularly visit a doctor and get prescriptions, get medicines. So, how does the Navia life care system works? Like, for example, if let's say somebody has to visit a doctor almost every week, so
Hmm.
do they get different prescriptions for each, or there's a concatenation which happens within the same prescription?
So that's a very interesting question. Actually, in order to answer that, I'll have to give you a brief background about how
Hmm.
how the system kind of works
Sure.
and why we have built it
Hmm.
in a way that we have. So the Navia Life Care has built a platform called the Navia Connected Care Platform,
Okay.
right?
Hmm.
As the name suggests, it's basically connecting the different stakeholders in the care continuum of care,
Hmm.
essentially.
Hmm.
When I say what do you mean by continuum care is basically that the patient is moving from one stakeholder to another, receiving care at every point. Okay, and even when he is out of a hospital system, for example, he's still getting the care that he needs. This care can be in the form of medications. This care can be in the form of, say, home health. It can be in the form of just rehabilitation or exercises or whatever, fitness, for example. They're all continuum of care elements.
Okay.
Okay. So what Navia does is basically it provides this platform that is based on the needs of the stakeholder. So the platform is in front of the doctor, who is the key decision maker of the ecosystem, right?
Right.
If you take the Indian healthcare ecosystem in general, you realize that all the decisions, uh, every instruction is actually flowing through the doctor.
Yeah.
Is the doctor decides which the doctor decides which drug to be prescribed. The doctor decides what procedure to be prescribed. The doctor decides when to come back, when the patient should get a vaccination, for example.
Yeah.
The doctor decides pretty much every single thing in the patient's treatment. So building something that the doctor can use easily is a centerpiece for the entire Navia ecosystem.
Yeah. Yeah.
Okay,
Hmm.
so we use these state of the art technology tools like voice recognition and handwriting recognition to make this process for doctors very very easy, right from managing their registering their patients and managing their patient profiles, to writing prescriptions, to conducting video calls, to conducting physical OPD examinations, to being able to view reports and records using mobile, for example. They're all being done in a very very simple and easy to use format,
Hmm. Hmm.
right? So once the doctor is sort of immersed in the ecosystem, then we are able to provide the patient with the necessary engagement tools that help them manage the chronic disease in a in a much easier format.
Hmm.
For example, when a doctor will write a prescription, he'll use either our voice recognition, or he'll write a handwriting recognition, or he'll use our clinical decision support to write a digital prescription for the patient. The patient receives it via WhatsApp or through SMS, in an encrypted link, which the patient can download and keep.
Okay.
At the same time, the same record is also available for the doctor to see when the patient is coming back for the second follow up. During the second follow up, the doctor may choose to just simply add a few elements to the same prescription. He doesn't necessarily have to write a fresh prescription every time,
Okay.
right? He or she just writes a few more elements and prints it out again, or saves it as a, like you said, a concatenation of the same record,
Hmm.
right? A continuation of the same record,
Yeah.
essentially.
Hmm.
So that's how we kind of ensure continuity of care.
And what happens in a scenario where the patient changes a doctor and the other doctor, the new
Yeah.
doctor, is not on Navia? Then how
Mhm.
does that work?
Right. So, like I said, there is it's all about the patient being the owner of the data,
Hmm. Hmm.
of his own record. So we have a patient-facing application called Navia Health Manager,
Okay.
where the patient has access to their records at any point in time.
Hmm.
If, say, the patient moves to a doctor where the doctor is not on Navia platform, he or she can still share their case summaries and their records using the Navia Health Manager directly with their doctor.
Hmm. Hmm.
So they can communicate. They can even, I mean, what we usually ask for is the patient to just recommend that the doctor also comes onto the Navia platform. It's a very easy onboarding process, and as soon as he comes on board, he can simply link with that patient. The patient can give access to their record, and everything is available. But even if the doctor is not on the platform, he or she can still see the patient's record using the Navia Health Manager app.
Okay. All right. All right. Interesting, because I can like really see the real life use case for this app, because like especially at my home also, my dad is diabetic, so
Okay.
he needs to manage and keep check on his health and always consult the doctor
Hmm.
on a regular basis. And sometimes what happens is, they'll ask you some historic questions, and
Right.
they'll ask you some prescription which happened back in 2018, you know
Hmm.
some life event that happened in 2018. And sometimes, it's really difficult to manage those files. Like I've seen his files, it's like piled up for like a 3 or 4 big file piles on in the drawer.
Hmm.
So I guess this is
Yeah.
a really good use case where at least, all the historic data is preserved, and whatever
Yes.
has been prescribed, or any surgeries, any sort of medication which happened throughout the journey of the patient is managed. That is
Hmm.
interesting. But how is this like? Because I also saw recently that Max has a platform, an online platform, where they also keep prescriptions of the patients, and
Yeah.
Fortis has also started, I guess. How is
Yeah.
Navia different from just if I just have to talk about the prescription point of view, not the voice and not
Hmm.
the handwriting recognition part, but
Hmm.
just for patient data management, how is Navia
Hmm.
different?
Yeah, sure. So, one of the things that you will see very categorically is that um, a Max app which has access to their records, or a Apollo app that has access to the records, will only be restricted to the records that are being generated through a Max or Apollo,
Hmm.
respectively,
Yeah.
right? But for a Navia app, that is never a restriction, right?
Hmm.
We do not restrict the patient to stay within one provider. A patient can move from one hospital to another, or from one doctor to another, and
Hmm.
have access to their records, no matter who they go to,
Right.
right? And
Hmm.
that is one of the key things. The other key point is that, like I said, NDHM, with NDHM coming in,
Hmm.
a lot of these platforms will become interoperable,
Okay.
which basically means that the patient's record can freely move from one platform to another without loss of data.
Hmm.
Okay. And that's where Navia is going to really stand out, because we are very, very close to NDHM compliance.
Okay.
We are, in fact, one of the first few companies in the country to become NDHM compliant.
All right. And
So we are working
what are
close.
the major points to consider when you have to be a NDHM compliant company?
So there is a there is a complete checklist.
Mm-hmm.
There are milestones that we need to change, or things that we need to change in our backend, in our system.
Okay.
We need to. It was a good thing for us that we already had a consent manager in place,
Hmm.
which is one of the cornerstones of building the NDHM platform.
Okay.
It's a good thing that we already had doctors who were using digital platforms and who were creating digital IDs.
Mm-hmm.
Every patient will get their unique digital health ID. So we were already creating health ID. So a lot of the things that are in the NDHM uh, requirement checklist were already done for us internally as well. So for us to move to that was very very slightly easier,
Mm-hmm.
easier than probably others. Having said that, I think it definitely creates a need here that NDHM compliance is obviously important from a doctor perspective, but also I think one of the key USPs of the platform of Navia is the fact that we focused a lot on ease of use.
Mm.
Um, and that actually goes a long way. So when we even if we build something for patients or we build something for doctors, it's all about ease of use. The easier we make it for the doctors to use it,
Mm-hmm.
the more applicable it becomes going into the future. And in DHM, compliance is just one part of
Right, right. Yeah, because even I was looking at the website right now. I could see, one of their
it.
main digital, building blocks that they have mentioned are, health IDs and digital doctors,
Mm.
your,
Mm.
the facility registry system where you can have your
Yeah.
personal data and all that. So how do you see this getting implemented in India, like from a private company point of view? How do you see
Mm.
this whole NDHM being implemented in India in the next, whatever years they are planning to do it?
So I think what is happening right now is are certain pilots being run in union territories.
Okay.
Uh, yeah, so certain doctors and certain facilities, certain health facilities, which are primarily based in union territories like Dadra and Nagar Haveli and Daman and Diu, or Puducherry, or even Chandigarh, for example.
Mm-hmm.
They're all undergoing pilots
Okay.
to basically these are all teething. It's a teething phase for NTHM where they're ironing out some kinks before they start rolling it out to the states.
Mm-hmm.
Because if they have to roll out in a state like Maharashtra, or if they want to roll out in a state like Uttar Pradesh, there are a lot of things that they need to consider
Yeah.
before they can roll out in such a populous environment. UTs are smaller, easier to work with, so it'll all depend on how the pilots kind of roll out. But from what I understand, the next 3 months are going to be crucial in understanding these pilots and getting some learnings out of these.
Mm-hmm.
Once the 3 month pilots or 3-4 month pilots are done, then probably it's going to be rolled out in certain other smaller states probably first, and then going into the more populous ones as they go along. That is the understanding that I have.
And what about the challenges apart from being compliant? Do you see any sort of a
Mm.
challenge with integration with NDHM?
Yeah, NDHM is not going to be easy for sure.
Mm-hmm.
I mean, it's not something. It's not a silver bullet. It's not going to solve issues. One of the key, one of the key learnings that we've had over the last 4 years of existence is the fact that um, user experience and ease of use are critical building blocks for adoption of a platform. Till the time your platform is not very very easy to use, getting a historically tech not so savvy population like doctors to use it is going to be a huge challenge.
Yeah.
um, Doctor and without the doctor's buy-in, it is unlikely that any healthcare platform or any kind of healthcare initiative in the Indian healthcare ecosystem will succeed. It's highly unlikely.
True that.
So we have to keep in mind that the ease of use or the ability for the doctors to basically be a part of it seamlessly becomes a very very critical thing on day one itself.
Yeah.
And that is what we've also done. So we've tried to keep the doctor in the center of the entire Navya ecosystem, build things according to the way they want to see things, and the way they interact with their patients and the way they run about on their daily life, and then everything kind of uh, falls automatically in place.
True, true.
So as long as NDHM guys or the team that is running the NDHM program keeps in mind that it's getting the doctors on board and getting the doctors' interests to be foremost. I think everything that'll change, put things into in the right direction.
And the hospitals need to align themselves as well, and I
Yes.
really feel that instead of having separate softwares for each of the hospitals, they paying somebody to make their own softwares, and at the end of the day, you are creating more problems for the patient. Like you rightly said, for any patient, let's say, who is for example getting treated at Max, now if he needs to go
Hmm.
to a Fortis, right, or a Medanta,
Hmm.
for that particular patient it becomes a hassle, because then he'll have to download those files again, keep it with himself, go to
Yeah.
Fortis or Medanta, give them those files. They may or may and this is one major issue again. Sometimes you go to a different doctor, the doctor will say, oh, I don't trust that report, we'll do this test again here, and then
Yeah.
they'll make you do the tests again. So how do you feel this thing is going to get resolved in the future?
So the fact is that this entire platform is going to be interoperable, right?
Hmm.
Which basically means that records from one facility can go to another without any hassle.
Hmm.
The patient just needs, it is all linked to one digital ID. So as long as the patient puts in the digital ID, he or she can see their records at any point in time.
Hmm.
They can also give consent to the hospital or to a healthcare provider to also see the records at that time.
Yeah.
So, and it's a timed consent principle of timed
Hmm.
consent, right?
Hmm.
Which basically means that I will allow you to see my record for X amount of time.
Yeah. Hmm.
So as soon as that comes in, as soon as that ability to give consent and be able to give access at the fingertips comes in, things will automatically fall into place, and this whole the issues that you mentioned will be solved pretty much automatically.
Hmm. No, well said, Kunal. So, with that, Kunal, we would like to wrap up today's episode. Thank you so much for being on the Socially Desi Show. It has been a pleasure hosting you today.
Thanks, Anurag, for having me.
So that wraps it up for today, folks. If you liked the episode, give it a big thumbs up, share it with your friends, and let's go viral. Remember, our weekly podcast features episodes on personal growth, mental health, relationships, business and entrepreneurship, and health and fitness. We would love to have Kunal on our show again in the future to discuss some more about the healthcare industry in India. So, if you haven't yet done so, hit that subscribe button and go check out our website at sociallydesi.com. And as always, before I sign off, remember, life is black and white and everything in between.